a small village, a quiet well, and a poison that traveled thousands of miles, all the way to the heart of an empire. What if one place, forgotten by maps and ignored by history books, changed the fate of millions? The story begins in the 19th century in a cluster of villages along the Ganges River Delta, in what is now Bangladesh and the Indian state of West Bengal. The British Empire controlled this land. They called it the jewel of their crown, but beneath the soil, something deadly was waiting. This story matters now because the legacy of that poison is still alive. Millions of people today drink water from the same sources. The decisions made by colonial rulers, and later by well-meaning health organizations, led to one of the largest mass poisonings in human history, not by an enemy, not by war, by a well. For centuries, people in rural Bengal drank surface water, rivers, ponds, and rain-fed tanks. Cholera and dysentery killed thousands every year. The water was visibly dirty. It was unsafe. In the 1970s, a major international effort began. UNICEF, the World Health Organization, and the government of Bangladesh partnered to fix the crisis. Their solution seemed obvious: dig deep tube wells, pull water from underground, clean water, safe water, or so they believed. Millions of tube wells were drilled across Bangladesh and West Bengal. By the 1980s, nearly 97% of the rural population had access to these wells. It was called a public health triumph. Aid agencies celebrated, but something was wrong. Quietly, in villages far from city hospitals, people began to change. Their skin darkened in strange patches. Hard, rough spots appeared on their palms and feet. Some lost feeling in their hands. Others couldn't walk. What would you notice first if your neighbor's skin started changing overnight? In 1983, a Bengali physician named Dr. K.C. Saha reported unusual skin lesions in patients from rural areas. He suspected arsenic. Nobody believed him at first. By the early 1990s, the evidence was impossible to ignore. Thousands of patients across West Bengal were showing classic signs of arsenicosis, arsenic poisoning. Researchers began testing the tube wells. What they found was catastrophic. The arsenic wasn't put there by anyone. It was natural, locked in the sediment of the ancient Ganges Delta for millions of years. But the tube wells had punctured the wrong layer of rock. The pumping changed the underground water pressure, and the arsenic dissolved into the water. By 1995, researchers confirmed that over 30 million people in Bangladesh alone were drinking arsenic-contaminated water. Some estimates later reached 70 million across the region. The poisoning was confirmed through multiple independent investigations. In 1997, the British medical journal The Lancet published a landmark study by Dipankar Chakraborty and his team at Jadavpur University, documenting widespread arsenic contamination across 42,000 villages in Bangladesh. UNICEF and the Bangladesh government confirmed the contamination in national surveys conducted between 1998 and 2001. Testing showed that over 27% of all tube wells in Bangladesh exceeded the national safety limit of 50 micrograms per liter. Researchers reported that arsenic had been present in the soil for thousands of years. It was geological, not industrial. According to environmental geologist Peter Ravenscroft of Cambridge University, the arsenic was released when organic matter in the sediment consumed oxygen, creating chemical conditions that freed the arsenic into groundwater. Not everyone agrees on who bears responsibility. Some researchers argue that international aid organizations moved too fast, drilling wells without testing the underground water first. Others say the science simply wasn't available at the time. Arsenic testing of deep groundwater was not standard practice in the 1970s. Some Bangladeshi officials have argued that the scale of the cholera crisis made fast action necessary. Thousands were dying from surface water disease every year. The tube wells saved lives from one threat, while unknowingly creating another. This is what public health experts call a risk trade-off. No easy villain, no simple answer. There are also gaps in the data. The exact number of deaths caused directly by arsenic-related cancers, bladder, lung, and skin, has never been fully counted. Arsenic poisoning is slow. It takes 10 to 20 years to show severe symptoms. Many rural patients were never formally diagnosed. Many deaths were recorded simply as cancer with no linked cause. In the villages of West Bengal and Bangladesh, the damage was quiet and slow, which made it harder to fight. A farmer would notice rough patches on his hands. His wife would see her skin darken along her arms. Their children would complain of tingling in their feet. They didn't connect it to the well. The well was supposed to be the safe choice. Families lost their earners. Men and women who could no longer work the fields fell into poverty. In some communities, people with visible skin lesions faced social stigma. They were avoided. Sometimes they were abandoned. The illness carried shame in places where no one understood what was happening. How do you fight a poison you cannot see, taste, or smell? Organizations like BRAC and Dhaka Community Hospital Trust worked for years to identify affected patients and provide treatment. But arsenic poisoning has no simple cure. The only real treatment is removing the source, stopping the exposure. For millions of people who had no other water option, that was not easy to do. Think of it this way. Imagine you fix a leaking roof, but while doing it, you accidentally crack the foundation. The roof stops leaking. Everyone celebrates. But the foundation crack grows quietly for 20 years. That is what happened here. This case became a landmark in environmental health. It showed the world that even well-intentioned interventions can cause harm when full testing is skipped. Today, hydrogeological screening, testing underground water layers before drilling, is considered a basic requirement by international health bodies. Bangladesh essentially wrote that rule with its suffering. The story also carries a deeper lesson about colonial infrastructure. The British Empire built few clean water systems in rural Bengal. When they left, the independent nations inherited a public health crisis. The tube well program was a response to that inherited failure. Understanding the arsenic crisis means understanding that history too. If you like the video, then subscribe to our channel for more of these fact-based documentaries. See you in next video.